Good afternoon. I'm Dr. Carl Thornfeldt of CT Dermatology, and this is my nurse practitioner, Brittany Irons. We are here to share with you about the latest changes that have occurred in the whole coronavirus epidemic, now known as COVID-19. There have now been reported several new skin conditions that are associated with the headache and the fever. These include hives, a rash that we often see with many virus infections, but specifically red face and neck that persists, and also we will see a pseudo frostbite. In other words, purple and red marks on the fingers and toes. Some of them have lumps within them. So if any of those occur, they can be a direct indication of infection with the COVID-19. I also want to share with you long-term treatment, because it's evident that this virus, in my mind, having done antiviral research since 1981, that this virus could stay around for many months, till even the end of the year. There are multiple reasons for that, which I won't get into in this discussion, but I do believe that our first break will occur here the last 2 weeks of June. I don't see anything breaking prior to that time to a significant degree. I do think the second big break would be the latter part of November. Consequently, we have to look at this as a long-term play. So what can we take that is going to provide long-term prevention and if we do get infected, will keep us from getting such a severe infection? I know with the number of supplements that people are taking that you can get fatigued with that. A little trick: it's been shown in prescription medications that taking them 6 out of the 7 days a week did not have any impact on efficacy. And yet it gave the people a chance to overcome their pill fatigue. So let's review those 3 supplements: artemisinin, Stamets 7, and quercetin. Artemisinin is a German E-Commission approved drug. What that means is that this drug has been shown to be effective and safe in the treatment of malaria, Crohn's disease, parasitic infections, and several other autoimmune diseases. So the German E-Commission allows doctors to prescribe it, and it is prescription in other parts of the world. But it also has a very important aspect that is very potent antiviral against the envelope viruses like coronavirus, and it also upregulates, in other words, it stimulates the arm of the immune system that is relatively deficient, that makes us more susceptible to the virus. We have good safety. 400 milligrams a day can be taken for 9 months. So we have long-term effects. The majority of people only need 200 milligrams a day for prevention. Secondly is quercetin, which is a flavonoid that is an extract of apples, onions, apricots, grapes, and certain berries. And this particular product is been purported by the chairman of the National Institute of Health that all dermatologists and their patients should be taking quercetin, because it does have an immune balancing effect. So it helps that suppressed arm of the immune system that allows us to be more susceptible to virus infections. It actually increases the function of that aspect. Plus it has some antiviral effect in and of itself. But it also prevents the massive inflammatory response that occurs, which you've heard about, that will engulf the lungs in the COVID-19 patients and produce the fatal event. In addition, it has been shown to prevent allergic reactions and to strengthen blood vessels. So it's been shown to reduce the incidence of strokes and heart attacks. So a very healthy supplement to be taking on a regular basis. The dose for that is 500 milligrams twice a day to 1,000 milligrams twice a day. Then the last one is Stamets 7. This is a product developed by Paul Stamets, the world's experts in therapeutic mushrooms. And he found that there are 7 different mushroom species that will provide potent antiviral and immune modulating effects in humans. They do this by providing beta-glucan, which is a polysaccharide that increases the arm of the immune system, the cellular immune system that is suppressed, that allows us to have viral infections. It also has antioxidant and anti-inflammatory polyphenols. It has anti-inflammatory and membrane strengthening ceramides. So a very broad spectrum agent that we can take as a oral supplement. 5 of these 7 herbs have no reported adverse reactions in humans. The other 2 do have rare or very rare reported reactions. So reishi mushroom has been reported to produce some respiratory effects. Again, very rare. It has also been shown to rarely be associated with increased nosebleeds and bleeding in other sites. So you would not want to use that in people who are on anticoagulants. The other is acarus mushroom. This particular type can produce an effect on blood sugars, reducing blood sugars in diabetics, and it can also have an impact in increasing insulin resistance. So those are the things that you need to worry about. Obviously, a person who has any allergy to any fungus at all should never take a mushroom extract. Now, I have periodically are questioned about what about these during pregnancy. We know that artemisinin should never be used during pregnancy or breastfeeding. But other than that, has been shown to be very safe. There has been a rare report that if you have seizures, that it may irritate the seizure focus, so you want to be used cautiously on that. If you're well controlled, we don't have to worry about that. So this is an update on the newest advances on agents that we can use to help reduce our risk of becoming infected and reduce the severity if we do become infected. I am available at CT Derm PC and at the CT Derm office here in Fruitland. Thank you so very much for taking the time with us this afternoon.